The heart is a double pump. It pumps to and from the lung as the pulmonary circuit, and from the heart to the rest of the system as the systemic circuit. The two superior chambers are the atria, inferior chambers are the ventricles. The heart is separated into right and left sides by the interventricular septum and the interatrial septum. Circulation through all of the chambers. We could start with the right atrium, which receives oxygen poor blood from the SVC, the IVC, also from the coronary sinus. From the right atrium, this blood goes through the tricuspid valve into the right ventricle. The right ventricle conducts the blood through the pulmonary valve into the pulmonary trunk, which splits into the right and left pulmonary arteries, going to the lungs to pick up oxygen, back to the left atrium via 4 pulmonary veins, carrying oxygen-rich blood. From the left atrium, the blood flows through the mitral or bicuspid valve into the thickest walled chamber, the left ventricle, which then conducts the blood through the aortic valve and into the aorta, hence the systemic circuit. The pericardium includes the outer fibrous pericardium and the underlying parietal and visceral pericardia. Between the two is the serous fluid containing pericardial cavity. Heart wall from outside in includes the epicardium, basically your visceral pericardium. The thickest layer of the heart wall is the muscle myocardium. Internally lining the heart would be the endocardium. External features of the heart includes the two auricles, which overlie and are continuous with the atria. This slide also shows two sulci. A sulcus is a shallow indentation. Coronary sulcus separates externally what internally would be the separation between the atria and the ventricles. The anterior interventricular sulcus contains some of the blood vessels that we will discuss in a little bit. Posterior view of the heart shows the coronary sinus, which is the largest of all the coronary veins. You could also see the middle cardiac vein. The apex of the heart is the inferior portion of the heart. Looking at the slide superiorly, you could see the 4 pulmonary veins. Recall that in the pulmonary circuit, the veins carry oxygen-rich blood, the arteries oxygen-poor blood. The 4 valves of the heart, again, are pictured here. On the right is a tricuspid, on the left, bicuspid or mitral. At the bases of the aorta and the pulmonary trunk are the aortic and pulmonary semilunar valves, respectively. Another mid-sagittal view through the interior of the heart. In this case, we could look at the right atrium first, RA, which also has the fossa ovalis. In fetal stages, it was the foramen ovale, which would directly link the blood between the two atria. This changes immediately after the newborn takes their first breath. Pectinate muscles would be the myocardial distribution of muscles within the auricles and also extending deeper into the right atrium. The two atrioventricular valves both have cusps, either 3 on the right, tricuspid, or 2 on the left, bicuspid. These cusps are then extended into tendinous cords, chordae tendineae, which in turn are anchored to papillary muscles, which are extensions of the myocardium. Some other myocardial elements in this slide include the ridges of myocardium, the trabeculae carneae, which are present in the walls of the ventricles only. The interventricular septum is also pictured here. Coronary circuit would be the blood vessels that provide blood to the heart itself. Coming off of the ascending aorta are the right and the left coronary arteries. The left coronary artery is quite short. Almost immediately, it branches into the anterior interventricular and the circumflex. The right coronary artery is much longer, proceeds all the way to the posterior, where it leads into the posterior interventricular coronary artery. There's also a marginal artery. Coronary veins, which ultimately drain into the right atrium, include the largest of all of the coronary veins, called the coronary sinus. There's also a middle and great cardiac vein, and also two smaller anterior cardiac veins. Conduction system of the heart includes the sinoatrial or SA node, also known as the pacemaker because it generates the contraction of the muscle. The SA node present within the right atrium will then transfer its message to contract to the right node, the right AV node. Then this AV node, atrioventricular node, will lead into the bundle of His, which enters into the interventricular septum, where it quickly divides into the right and the left bundle branches, which lead all the way down to the apex of the heart. At that point, both branches, bundle branches, will go up through the ventricular walls and end up as Purkinje fibers, which will then cause the ventricles to contract.